Hello, Protrusive. I'm Jazz Galati, and welcome back to an Interference Cast. Now, if you're new to the podcast, welcome. It's great to have you. An Interference Cast is a non-clinical interruption, and if you're a usual listener, welcome back. In this episode, we have Ferhan Ahmed. Now, Ferhan is an awesome clinician, and he wrote this book called Unstoppable, which is a great contribution because it does so much for charity, but it's one of those books which is very much in the realms of personal development. I'm a sucker for personal development books. I love anything in that genre of personal development. So the reason I like this book by Ferhan is that it's a personal development book, but it talks to me. It talked to me as a dentist because he is a dentist turned medic, and now he focuses on full arch implant work. And it was very inspiring. I think it's something that, we need to focus more on the non-clinical sometimes, be it the mindset. So what you can expect to gain from this episode is to explore a little bit about your learning style. What is your learning style? And really focusing on bigger picture type stuff. And one of the biggest takeaways, I think, is the power of visualization. Now, I'll let Ferhan do the honors and explain a bit, but the times where I use visualization is like a macro visualization, like bigger projects, like when I'm developing the podcast, I'm visualizing things. When I do public speaking or lecturing or whatever, I am going to be doing some visualization in my head. I would have given that talk with my eyes closed when I'm in bed, and I would have spoken to people how I'm going to look, how I'm going to say things, what I'm going to say. So a lot of times I've rehearsed things in my mind, but also, like, if I'm doing a surgical wisdom tooth that's just beyond my comfort zone, I will mentally rehearse that surgical procedure. Or if I'm doing anything complex, multiple crowns, things that are just stepping out of my comfort zone, I'm always rehearsing it in my mind. What could possibly go wrong? How am I going to accept the instrument from my nurse's hand, like to those tiny little details? So one big takeaway from this episode is the power of visualization. Anyway, hope you enjoy this Interference Cast with Ferhan, and let's become unstoppable. Ferhan Ahmed, welcome to the Protrusive Dental Podcast, my friend.
Thanks, man.
We already had a little bit of a spicy intro there, so already I know we're going to get so much value here. We talked about morning routines already. We talked about productivity, so I know it's going to be one of those like a million miles an hour, but in a good way. I mean, all quite positive. I'm with you now. I've seen you on Instagram. I know that you fly around to different clinics and you mentor them on implants and complex dentistry, which is amazing. So tell us, for those who don't know who you are, a little bit more about what drives you and your passions. And we're going to get into more of it. I feel like I know you already because I read some of your book now. So tell us a little bit about for yourself for the listeners.
Yeah, thanks, Jazz. My name's Ferhan, and I initially saw myself as a dentist. Then I went through a phase in my life where I saw myself as a medic, and then I had kids and as a father. And then it's a question I've been really asking myself, what do I see myself as? And I just wanted one word. And the word that came to my mind was creative. I want to be a creator. That's what I want to be known as. That's what I feel is I can be most closely aligned with. Yeah, I teach, I mentor, I'm a dad, I'm a husband, I'm a son, I'm a brother. But what is closest to my heart is someone that people look at me and think, yeah, he's quite creative. He's always looking to do something, innovate and create. And as I'm going into the 4th decade of my life, that's what I want to really focus on in being a creator. So yeah, I'd love to think of me as a creative or a creator. But most people know me as an implant dentist, and I have a passion for education and training within implant dentistry, and that really stems from impact. That's one word that I think about most days, and that's impact. And what impact, I ask myself the question, Ferhan, what impact are you having? What impact are you wanting? And in 10 years' time, what impact have you had? And the pandemic hit, and it was, none of us really expected it, and it changed everything. It was an enforced rest at home, 3 months, and I was like, what am I going to do? And I was like, I'm going to make the absolute most of this opportunity. And for me, I've always felt my impact comes from the work I do. So I was an implant dentist that rehabilitated a lot of people with failing or denture wearers, rehabilitated them and gave them fixed teeth. And really, how I asked myself the question, how can I have a bigger impact? Well, how much full arch implant dentistry can I do day in, day out? It's tiring, it's physically, mentally draining. And so I could do maybe 4 cases, 5 cases a week. That's 20 a year, that's 240. 20 a month, 240 a year. But what if, Ferhan, if you could train 1,000 dentists to get the predictability, the reproducibility, the consistency that you can get with full arch implant dentistry, then the impact would be bigger. And so that's where the online program came from. That's where the one-to-one mentoring comes from. That's where the live courses aligned with it online and the community I'm trying to build within full arch implant dentistry is coming from. It's all based around one word: impact. That I can, from 10 years down the line, look back and think, yeah, I did all I could to have the biggest impact I could around this particular area within implant dentistry, and that's full arch implants. So yeah, impact, being a creator.
How did it develop into that? So you went from dental school to medical school. Most people who do that have got max facts in their mind. So what made you opt away from the typical maxillofacial route and treating oncology and being a registrar consultant and that, and then thinking, okay, you know what, I'm going to go into implantology and private practice?
Yeah, so I suppose it's the best way to look at it is doors. We all have a vision to get to an end point, and that may be door 10. But I've always looked at life just taking a small step and just going to door 2, opening that door and see what happens, and then opening the next door after I'm through door 2, settled. Let's see the opportunity. And so when I thought about doing medicine, I was in the environment around maxillofacial consultants, and they inspired me. They impacted me, and I wanted to be like them. And so for me to be like them, I had to pursue a second degree, and that happened to be medicine. And I went down to Liverpool and did a 4-year postgraduate degree. However, I also was aware that it'd be okay not to follow that career. I was okay with that, because one of the other reasons I wanted to do medicine was just that, seeking more knowledge, to be a bit different, to just better myself. And so I went down to do medicine with the proviso that, yeah, I could do max facs, or it'd be just good to have a medical degree. It's never going to hold me back. It's always just going to be an advantage. It's going to make me stand out from the rest. And what's the worst that could happen? Yeah, 4 years have gone, but I've got a degree, and it's a worthwhile degree that'll just add to my dental background. So that's where the sort of medicine came. I did, and then once I finished, and I'm also one of those people, once I start, I don't stop, So yeah, there were times where this is tough, working on calls at nights, at weekends, in between all the learning that was going on, struggling with money. But I was like, no, I got to keep going. And then come towards the end, it's a big relief. You're like, great. And then you have to kind of do the foundation years just to get the full registration onto the GMC, etc. And then an opportunity arose for me to step out of that journey into becoming a maxillofacial surgeon. And I had an option, and I chose the option to join a group of dental practices that were growing and become a partner. And that was it. So really, I was at door 3. I went through, and I had a couple of options, and I chose one that involved stepping away from the training pathway to becoming a maxillofacial surgeon, and going towards where I would be much more independent. I'd have much more that freedom to do what I wanted and not have to fit into a system. And it was simple as that. And I look back now and feel that it was the right decision. However, I'm also that type of person that's just optimistic and just grateful for what I have, that if I'd gone down the career of a maxillofacial surgeon, I feel I would have made the most of that, and I would have looked back and thought, yeah, this was the path that I was meant to follow, and it's all good. But at this moment in time, I'm very fortunate for everything that I have around me, and that sort of freedom to do what I want and work where I want, work with who I want, and that ability to, support my family. So yeah, very grateful for that.
Well, there are many young dentists listening who may be pursuing a full-time master's, or medical school could be looming, just like it was for you. So just give us a bit of advice to those people who may be pursuing a MClin Dent as well, for example, right? And that's very immersive, time away from family, time away from earnings. So the LOE, loss of earnings factor, comes in. What advice can you give to them, in your most darkest moment during your medical training, when your friends around you were earning and spending and holidays and that kind of stuff, and you were still a perpetual student that never ends? What advice can you give to those who are in the midst of that?
Well, what I would say about that is a motto that I hold dear to my heart is I always put learning before earning. And learning and upskilling and increasing your knowledge is immensely, immensely powerful, and it will never hold you back. But what I do see is, especially now within dentistry medicine, there's such an abundance of courses, training programs, qualifications. You have to be careful and make that decision wisely, because it's a huge investment, and not only of your time, but financial investment. But you've got to think about your return on investment. And once that course is completed, or once you're on that course, really, how is that going to, sort of propel your career forward? How are you going to utilize the skills that you've learned and really sort of push on? And I see this all the time. I've been involved in teaching and attending numerous courses, and clinicians turn up to these courses ill prepared. And what I mean by is ill prepared, they've not really prepped themselves on how they're going to move forward once they've learned this new skill. So, for instance, they've done a bone grafting course, and then they come out the bone grafting course, and then they don't actually apply any of the skills, the knowledge they've learned, until a year later, and then they've forgotten. So, what I say to clinicians that I work with is, you've got to be continuously learning and looking to apply simultaneously. Otherwise, it's pointless. It's pointless to get involved in training, upskilling, if you're not going to be
100%.
applying it. And the application doesn't just happen on its own. It's active, and sometimes it's not in your control. So let's take example implants. Now, you could be most clinicians are associates. They work in a practice, and there's a principal or with a corporate. Now, the question is that practice environment going to help you get the work in? Are they going to market for you? Are they going to build a team around you so you can support implant patients? What's the point of doing an MSc in implant dentistry if there's no plan to get patients in? You're not going to have that opportunity to reinforce the learning. And so really what it is, it's just sitting down and planning around formal further education and how you're going to apply that. So really it's about that, and really taking this holistic approach to training and really thinking about a return on investment, because that's what's really important. So you can fork out 50, 60,000 pounds for MSc, loss of earnings, investment in the course, but are you getting that money back, and how long is it going to take you? Otherwise, please don't do it. That would be my advice.
No, I was going to say, whether it's a big program like you mentioned, or if it's a smaller course. I mean, nowadays, I did so many courses in my first 5 years, but nowadays, I definitely agree with you. Before I book onto any course now, I will make sure that I have got a couple of crown lengthening patients, for example, this crown lengthening course, ready to be treated on when I come back from that course. Or if it's a composite course now, I'll make sure, for example, I'm looking forward to doing Dr. Costas's injectable composite course. But I know that once I've got 3-4 patients lined up who have treatment plan for that, and they've agreed, the fees have all agreed, and they're ready for it, only then would I go on such a course now. So my mentality's changed a lot. Whereas before I was very much exposing myself to new knowledge and stuff. I think now, especially with the current environment, definitely you have to make sure it's applicable first thing. And you mentioned about the whole working to learn, not to earn. I was in one scenario when I got back from Singapore where I was offered 2 positions, one in Harley Street and one in Windsor, and both had good principals and good support networks and stuff. But I was told by my friend Biju Krishnan, if you want to work with this principal, you will make a lot of money. But if you want to work with the other principal, you might not make a lot of money, but you'll learn a lot more. And I definitely picked the one to learn a lot more. So I worked in Windsor with Dave Winkler, and I think it's one of my that's why I think we're a bit quite similar ethos, and I echo that for all young dentists listening. The next question I had was
just on that note, and I couldn't agree with you more. Some of the clinicians, when I work with them on a one-to-one basis, I have really frank conversations with them, and I openly disclose how much I make, and I openly have disclosed the history, the evolution of my earnings, and I've said, this is what's happened to my earnings over the years because I've done this. All you do is just copy that. I've invested, and now I bear the fruits. It's a no-brainer. It's not about short-term gain. It's long-term sustained gain. And people see me flying about working. That's choice. I'm at such a fortunate position now where I don't need to work anywhere near 5 days a week to have a really good life. And that's because of all the effort that I've made in the past. And now it's purely like it's a choice. I thrive off the high-paced environment that I work in. But if you just, sort of invest the time where the focus isn't how much am I making, what percentage am I on, and actually thinking about the people and the exposure you're getting, then it will always bear fruits if you have that sort of open mind to opportunities. You'll never regret it, never.
Absolutely agreed. And on that similar theme, you go from these posts and courses and you apply, and yes, you might be doing a training post like a DCT post. You're not earning as much, but you look 5 years later and you're earning way more potentially than your colleagues because you've been through that hardship, you've been through that struggle, and you amassed that knowledge. And like you said, every opportunity to learn is one, from your book is one you should take. And so one of the other themes that you talk about in your book is the power of visualization. And I really like that because on a macro level, I used to even do this before I became a dentist, because before even getting to dental school, that's all I wanted to be, right? I wanted to be a dentist. That was my big dream since I was age 14. And so I used to visualize myself with an offer in my hand, or visualize myself at dental school. So that's like the macro level thinking. But I also like the mental rehearsal you mentioned in the book, whereby before a big procedure, I always close my eyes and I jot down the exact equipment I'll use as and when I'll use it. So I can then give that to my nurse, so she knows exactly what I'm going to need at what point, because I've already mentally rehearsed that case, that procedure. So I'm a big fan of that. So just tell us a little bit, expand more about the power of visualization in terms of yielding better results for you as a clinician.
Really, Jazz, it's exactly what you've said. And for me, when I would, particularly as you start to take on more complex cases, it becomes more important that you really are able to visualize everything in front of you, and almost, I'll close my eyes, or the night before a big case, I'll be in bed and I'll just think about it. And I don't know if you've seen The Queen's Gambit, where what's her name, Martha Melissa?
Is that the one about chess, right? Yep.
Yes.
Yes. So she's laying down and she's seeing all the chess pieces above her. Yeah.
That's exactly what happens. Yeah, I can lie in my bed and I can see the bone because we've worked everything out in a CBCT, and we've planned it on a CBCT, and so I can see exactly what it is that I'm doing because we've got a 3D render, and sometimes actually we print those 3D renders so I can actually hold the bone, and it's about closing your eyes, or actually you do it so much you can do it with your eyes open. You just see it all, how you're going to create your incision and the steps you're going to go through to create your incision, what instruments you're going to have in one hand and the other, and how you're going to paint, brush the tissues, open everything up, control the hemostasis, how your assistant's going to position their instrument so you've got the correct access, be able to visualize everything. It's critical step, especially in the learning and as you upskill in a particular procedure. Then it gets to a point where now, if I was doing simple, a lot of full arch work, I don't do that. But when I'm doing anything complex or anything that I don't do on a routine basis, I go back to it. I have to mentally rehearse that, visualize it in front of me happening. And that's not once, that's multiple times. And back to what you sort of said is writing it out. Mm-hmm. Yeah, I've been there where I wrote every single step out. The local administrating 8 cartridges of Articaine at this point, everything all written out. And also it's really nice to then share that written, sort of rehearsed treatment protocol with the team, so they're aware of exactly each step. Because what we must remember is that we're only as good as our team, especially when we're doing big complex surgery. Your assistant and other team members that are in the room need to be aware of each step, because I get into this state of flow when I'm operating, and I don't want anything to sort of bring any sort of jeopardy to that system.
Disrupt that.
Yeah, disrupt that flow that I'm in, because it can throw you off. So don't want any disruptions. We follow the silent cockpit protocol. We have very calming music in the background, and everybody knows exactly the steps involved, what their role is, and then all being well, that's how you execute the procedure. So that's, I really can't emphasize the importance of visualization when it comes to surgical procedures. But like you sort of mentioned, there's visualization professionally, but there's also personal visualization. And so I will often visualize. If you look at you read books by David Goggins, Can't Hurt Me, he talks about, he has a visualization mirror, a board. People talk about visualization boards where they take a picture of their dream house, they put it up. They take pictures of their dream car, they put it up. The clothes they want to wear, the holidays they want to go. And you really, if you start to look at these things every single day, then you start to believe that's where you should be. That's the house you should live. That's the holidays you should have. That's the car you should drive. And then when you start to see yourself living that life, then it's just the way the world works. You'll start to sort of follow that path that'll lead you there. I mean, I'm a big believer in that.
So am I, Ferhan. So am I, and I do practice it. And you just mentioned briefly about how I told you I don't like to write it down. You said you like to write it down. I read in the book about you being, you like to watch videos and then write things and draw things. And so I first realized that I'm a visual learner when I realized that every time someone not Indian or not English mentions their name, and I'm like, wait, how do you spell that? Or how do you spell this? And then but when they spell it, in my mind, I'm sort of writing it out. And then when I have a visual mental image of it, that's when I've absolutely going to etch it and pronounce it perfectly from then onwards, basically. So I know I'm a visual learner, a visual person in general. How else can people figure out what kind of learning styles there are? Because for you as an educator, you need to also suss out what kind of a learner someone is. But how can you assist learners in finding out what their learning style is? Because one of your themes in the book, and one thing we're both very passionate about, is the importance of lifelong education. So I think the sooner we figure out what kind of learner we are, the more empowered we can be.
Yeah, so sort of going back to when I really discovered learning for myself is back to university days. And you go through this sort of journey of discovery where you're trying to figure out the best way to learn this essay on biochemistry, physiology that you need to write, or start to learn anatomy. And you go through a process of trial and error, working out. And I soon realized that I liked colors. I liked writing things down repetitively. I like to have big chunks of text and then start to break them down and then work out acronyms. I used to have a friend that I used to pair up with, and a great way of learning is I would teach him something, he would teach me something back. We would stand up in front of each other and go through just describing what we'd learned over the last hour, and that reinforced learning. So it's really discovering yourself, having that self-awareness and looking back, because without realizing, you probably know what it is that is the way that you learn in sort of your specific learning skill is, and learning technique is. And it's just sort of taking a moment, thinking, I went through university, I've done this is how I learned. I didn't enjoy that. I remember, actually, now that you've sort of asked this question, I used to have a tape recorder, and I used to record like chapters in a book, and I used to go to sleep, because I don't know where I read this, but there was this sort of, if you can listen to something while you sleep, it sort of sinks into your brain. I don't know how true this is, but during dental school, I recorded hours and hours of content that I would have on a tape recorder, and I was walking. I would just play to myself and reinforce my learning. I don't know how much that had an impact on me, but now, I mean, I'm an avid listener of podcasts, including your podcast, podcasts in general, audiobooks, because audio is another great way that I like to learn. So different ways, and it's about discovering it. Are you visual? Are you audio? Do you like the print? Or do you like to get creative with your learning where you start to record yourself saying things, summarizing it? But another one great way to learn is, I think this is one of the best ways to learn. I find myself, and when I work with other clinicians, they also find this really helpful, is teaching others. When I get up in front of people and I'm giving them a lecture, one of the first things I like to say to them is, I want 3 takeaways. I want, after we finish this stint of teaching, I want you to take away 3 things, and I want you to write them out, and I'll ask you at the end. So 3 takeaways from this lecture. The other thing I like to say is, you have to approach this learning as if you're going to teach it to someone else in 48 hours. And what that does, it deepens our understanding and our concentration during that period. When we approach it in that manner, where the thought process, I'm going to have to teach this to someone else, and how would I do that? And then go and do that. And I think that's very powerful. So these are some of the things that I sort of bring up when I'm lecturing, teaching other clinicians, that this is the type of approach. But it is discovery, it's self-awareness, and it's trial and error. It's reflecting what works, because we all are individual, and I really believe learning should be personalized. And it's my responsibility as an educator to understand the clinicians I'm working with, how it is that they learn, or it's my responsibility to help them discover how it is that they learn. Because you can be a phenomenal clinician, surgeon, whatever it is that you do, but you can be a poor educator. And I think they're 2 different roles. It's not that they can't be aligned. Absolutely, they can be aligned, but they're 2 different skills. And that's my approach to it.
You mentioned you listen to podcasts as well. Do you do this thing, which I do, where I listen to the podcast at 2 times normal speed, or 2.2 times? Have you, is that the kind of thing that you practice as well?
100%. Absolutely. Because what that allows you to do is listen to double the amount of content. So I drive a lot. And when I say I drive a lot, I do about 40 to 45,000 miles on the road every year. So I drive a lot. I get through a lot of audiobooks. I get through a lot of podcasts, and I listen to them at
driving university.
Yeah. And you it's really amazing how your mind, your listening capacity becomes quickly trained to listening to audiobooks through Audible or podcasts at 2.5 speed. And actually, my online modules...
Yeah, the first time you do it, it's like, what the hell is this? But then it becomes so easy. And now I'm creeping up more and more and more. And still, now when I listen to people speak, they're like, why are you speaking so slowly? But because I'm so used to listening at 2 times that everyone else seems really slow.
Yeah. No, I think it's really worthwhile. And it's amazing how quickly you adapt to listening to things at 2.5 speed. What's funny is sometimes I've had a passenger in my car, and I'm listening to a podcast, because I don't mind who's in the car. I was like, yeah, I'm listening to this. I'm going to finish it off. And then they're like, I can't make sense of it. I was like, yeah, you'll be fine. You'll get used to it.
Gibberish.
You'll get used to it. Yeah, it's gibberish. You're like, how do you understand that? I was like, yeah, it's absolutely fine. But yeah, I think that's
my wife's the same when she's in the car. Actually, it is, and you pick it up. So for those of you listening to this podcast right now, come on, crank it up already. Go to 2 times, you'll get through more episodes. I promise you that. I only got through to up to about chapter 4 in your book. So I want you to say, of the rest of the chapters, what is a big takeaway, a big lesson, or something that you're really passionate about in the rest of the book? Because I covered a few of the themes that you talk about in the book already. What is the main takeaway message that you want to get dentists to know that you've covered in the book that you think would really be impactful for those listening now?
The main message of the whole book is the title. It's being unstoppable. And for that, for me, that means having this inner drive, which is so deep and consistent that you keep going regardless of challenges, and it's striving for those goals and dreams that you have. So that's sort of the main theme and the reason why I've sort of the message behind the book. And it was created because, for me, there's different ways I can have impact. And I had this opportunity, when the student appears, when the student is ready, the teacher appears, that famous saying. So I didn't realize I had a book in me, but I encountered an opportunity, and someone was there to help guide me and bring it to fruition. In terms of other themes through the book that you're going to come on to, one is mentorship and having mentors and heroes. I am very fortunate that in my life, my career, not just from school, but all the way up to today, I have had people that have been profoundly influential in my career and have allowed me to become the clinician I am today. And to them, I am forever grateful. I wouldn't be here without their guidance, their support, and mentorship, and having heroes in your life. So people that you look up to, maybe you don't have a direct link to them, but you look up to them, you're inspired by them, and you look at them and think to yourself, yeah, I can strive to get to that level, because that we need those types of people in our life too. So I think that's a really important aspect. And then the final chapter talks about charity, and that's something that's very close to my heart. Back in 2014, a group of colleagues set up Dental Aid Network. They're friends based around where I grew up in Glasgow. A lot of us were at dental school together. And the sort of aim of the charity was to help children in conflict areas with basic dental care. And so we've led numerous missions to Africa, Middle East, Asia, where we treat people that really wouldn't have access to basic dental care. And when it comes to charity, I think it's so important to be able to give back, not only give back when you get to a certain level and help people along the way. I think that's important, but charity where we're giving back and helping those less fortunate. As dentists, we're in a really privileged position, comfortable, earn well. It's important to give back. And one of the sort of aims of the book is to hopefully raise, my target is £50,000, sell that. I need to sell around 10,000 copies of the book. And I'm hoping to build a dental clinic in Kashmir so it can provide basic dental care for a community of children in a particular area. So I think charity, mentorship is two themes that you're going to...
Mate, that is absolutely brilliant.
So, I mean, yeah, it's again about impact.
I just wanted to say, Ferhan, before you continue, just on that message, it would be great if you can achieve, I think you will achieve that number.
Thank
because
you.
That's such a wonderful thing. If you could do that, to build that dental school in Kashmir, it's a wonderful thought to be able to do that. And I just want to say for those who maybe are new to this book, or I know it's launching soon. At the time of recording, I know it's launching soon. But one thing I liked about it was that there are people who talk about motivation. There are people who talk about visualization. So I'm already attuned to that. But coming from you, someone who's walked the same path that I walked before, coming from a dentist, a wet-fingered practitioner, it made it much more relatable. And then you have these sort of comparisons to actually real-life dental scenarios. So that made it come much more to the surface for me. So that's why I'd recommend that book to all the dentists listening right now. And of course, with an amazing aim that you have here, everyone should be rushing out to get this. And I will put the Amazon link on the blog post as well, for sure.
Wonderful. Yeah, I really, really appreciate that. But yeah, so I would love to hit that target and build the dental clinic. And then, it's about sort of, again, back to that one word, impact, where I've managed to create a piece of written work. If that can then go and help other people, and it can be a lasting legacy where the impact is ongoing, it's consistent, and it's hopefully talked about, it's all the more rewarding for me, and I'm hoping that it will then spur me on to do more and more. Well, like anything, when we're pushing ourselves, we're trying to be as creative as possible, we rely on people accepting what we're putting out and what we're doing. The clinicians I teach, I want feedback from them that I'm doing a good job, that I'm making a difference, that I've had an impact on them, for them to upskill and sort of do the work that I'd planned to teach them, and they're doing it independently. That's massively important, because then that sort of pushes me to do more to become more myself. And so it's a two-way process where the teaching side, it's two-way. I rely on the clinicians I work with to spur me on to be better. And then in terms of what I'm trying to create through written or through audio or through pictures, I rely on feedback from other people to see what works, what doesn't work, how I can change things to have that bigger impact. I think that's really really important to me.
How do you plan to reward yourself? Because one of the things you talked about was, we do all this visualization, mental rehearsal, but then when you actually achieve something, okay, after you've rehearsed it, sometimes I've been guilty of not rewarding myself, whatever, and I'm slowly working on that. But how do you intend to reward yourself once you get the launch out? Because it takes a lot of work to produce something like this.
Yeah, probably. I think it is important to reward yourself, but I just, sort of going back, what I'd say is good. I talk to myself and I'd say, well done, that's good, that's done, what's next? And if you've read any of the books by Tim Glover, Relentless, and so Tim Glover, if you've not heard of him, is the guy that coached Kobe Bryant and Michael Jordan. He's got a new book out. Cool. I forgot what it's called, but he's got one book called Unrelentless. I'm pretty sure it's called Unrelentless. And it's a phenomenal read. And it's like, what he said about Kobe and Michael Jordan really resonated with me. They'd work their socks off. They'd win the NBA that year. They'd get the ring. And then they'd be like, right, okay, I'm after number 6. And then I'm after number 7. And so for me, it's like saying to myself, yeah, that's great. You've built a community of 100 implant dentists that you're working with. The book's in print. It's being launched. For me, it's what's next. It's what's next. And yeah, I say, yeah, great, Ferhan, that's cool. I say, well done, that's an achievement. But for me, it's always what's next. And, I'm not one of those like, I should take some time off. I should, buy myself something nice. That doesn't do it for me. It's for me, it's what's next. And then I suppose the reward really would be is coming up with something better next time and being able to push myself to be better continuously. That would be my reward, where I've built something right. So how am I adding to that? How am I going to make this better next time? How am I going to create something bigger? That's really what sort of drives me. And that's my reward, is if I'm able to do something better next time.
Brilliant. Now, I know you're really into your books as well, as am I, and all the audio books you listen to. In fact, funnily enough, when I was reading about visualization, I was preparing a quote to share with everyone here. As I turned the page, that exact same quote was the one you had on the top of that chapter already, which was everything is created twice, first in the mind and then in reality, by Stephen Covey. So I was really glad you shared that. But tell us about your favorite, because I got a section on the website for books and whatnot. Just shout out some of your favorite books. So you mentioned about the Hal Elrod's book, The Miracle Morning. Obviously we can also do a shout out to 7 Habits of Highly Effective People, since you got Stephen Covey's quote there. You mentioned Unrelentless. What are your other favorite books to drive us?
Okay, so Napoleon Hill, Think and Grow Rich, absolute classic.
Yep.
I've got a pile of books here. I love Tim Ferriss. I've got the 4-Hour Work Week there. That's a phenomenal book. You need to let me go into my Audible and remind myself.
All right, while you're doing that, then my last question was going to be, while you're doing that, is just tell us, just so you can think about it, is you got a whole bit on communication with patients in there. We haven't really touched on that theme. So I'd like to extract from you your biggest communication tip that you can share with us.
I think empathy is absolutely crucial, especially in our line of work as clinicians, where you step back and really try to understand your patients, why it is that they've come to you and what it is they really want. It's not white teeth. It's not straight teeth. It's not, what do patients come in? It's not, patients are there for a reason, and it's more than just white teeth, straight teeth, shiny teeth, whatever it is. Patients want confidence. They want the ability, they want comfort, they want confidence. They want to be able to, often a lot of the patients I'm managing, they want to have function, so eat with comfort. And it's empathizing towards patients about the difficulties that they're going through with their dentition, which is really such a crucial part of the face, the smile, and it's really trying to understand patients when it comes to them presenting in your clinics. So I think that is absolutely crucial. So having that empathy and being able to gain your patient's trust, and that, yeah, it's hard initially as you're a young practitioner, upskilling, gaining experience, but it comes, and it's something that you need to work on, reflect on, and always look to improve and evolve. But gaining patients' trust, and then when they trust you, that's really when the magic happens. When patients come in, and I just, after years and years of having patient interactions, it's such a relaxed part of the work I do where I can just sit there relaxed, give the patient a smile, and just go, how can I help you? Or what can I help you with? Or I understand that this is a problem. How is it that I can help you with that? And it's nice to be in a really kind of calm, comfortable place internally as a clinician when you're having that conversation with patients. And it's hard to describe it and say what it is that changes, but something happens when you start to develop that, and it becomes that's the clinician you become. And then patients sense that. Patients sense the comfort and the peace that you're internally, sort of that what's going on inside you when it comes to that conversation. They sense that. I don't know what it is, but they sense it. And when they like that sense that this clinician is putting me at ease, he's understanding, he's empathizing, I trust this guy. And then they're like, yeah. And when they trust you, they accept your treatment plan, they accept your advice. And then that's the start of a real strong patient-clinician relationship. And that's what we want. Because at the end of the day, we can never predict how treatment's going to, with 100% certainty, how the treatment's going to go. But if you have that trust, then patients are much more accepting of potential hiccups that can occur during that journey. Now, let me see where that...
Whenever I think of trust, before you get that out, whenever I think of trust, I remember something that Raj Ratan, my old training program director during DF1, taught us about trust. And it's an interesting thing. He said, trust with patients, you earn it in little drops. So you earn it in drops, but when you lose it in buckets. It's one of those things, basically. So you have to keep working, keep earning that trust. And with some patients who are more trusting, yes, it's easier. Others, you just have to, everything about you, the environment you're in, the way you present yourself, the voice tone that you produce, the confidence that you have in yourself. And it's not like egotistical or overconfidence. It's just like reassuring the patient that, you know what, you're in safe hands, and we care. And on that topic of care, while you're just getting those books out, is what I like was that you still get nervous before big procedures, because and you talk about this because same here, right? When I'm doing multiple preps or big large provisionals and stuff, very different the nature of what you're doing, but I still get a little bit nervous. And the reason we get nervous, Ferhan, is because we generally care about the person at the end of that treatment, and we want them to have a good result. So, like you said, the day you stop getting nervous is the day you might stop working, because that's when you maybe have lost that sort of feeling, that connection. So it's important to have that human side about you.
Yeah, absolutely. The response, I will never lose something, and that's the trust that patients put in me every day to inject them, to cut them open, to drill away their bone, to start drilling into their bone, to screw in metal screws into their jaw. That's a hell of a lot of trust. And it's easy to forget that, really easy to forget that, because we're just getting to this circle and we're just on repeat all the time. But it's a big thing for a patient to come in, sit down, open their mouth and go, that's fine, Dr. Ahmed, you just crack on. It's a big responsibility that we have as clinicians when patients do that. And we must never forget that. And it's an honor. It really is, when patients trust us like that. And I think it's something that we need to step back and think about on a regular basis. So sort of going back to the nerves, and even when I'm doing sort of straightforward treatment, I'm like, right, I'm here, I've got to perform, I've got to do my best. And I'll often often say that to the team in the morning if we've got a busy day of surgery ahead. Said, one, I'm not doing this on my own. We all need to perform here. We're going to do our absolute best. And so we start the day with a team huddle discussing this, and often talking about actually how lucky we are to be doing this type of work and the trust that patients have with us. And it's not just me, it's the whole team. And then at the end of the day, reflecting on the work and me saying to the team, thanks a lot for everything, because I couldn't have done it without you. And we've done a lot of good work today. And if I go back to, I did a couple of cases with a colleague in London on Saturday, and the first patient was a denture wearer, 90-year-old denture wearer. And she came in and we raised the flap, put in 4 implants, gave her a fixed set of teeth. And we changed her life. The second patient came in with a failing dentition. We took out her teeth. We put in 4 implants. We gave her fixed teeth. And we changed her life. And I said at the end of the day to the 2 girls, the nurses that were working with us, I said, we've done some immense work today, and you two should be really proud. We've changed lives. And don't forget that this is not anything to be taken lightly. This is life-changing treatment, and you had a big part in this. So thank you.
That's a really good way to put it.
And I'm very fortunate. I'm fortunate for the people that taught me to be able to do the work I do. And I feel fortunate that I can do it now and teach others. And I hope I never forget that, because it's a privileged position to be in. So on to books. I managed, although I managed to lock myself out of my Audible. So I'll give 2 books that actually I talk about on a regular basis.
Yes.
The first one is Atomic Habits by James Clear. Phenomenal book, because it's our habits that really set the tone for who we are and who we become. And it's having the good habits. And James Clear presents it beautifully in his book, Atomic Habits. I also encourage you to subscribe to his newsletter, which comes out every week. And it's 3-2-1, 3 thoughts from himself, 2 thoughts from others, and 1 question he asks you. It's phenomenal. I always look forward to it every week. And it's all based around his book, Atomic Habits. And it really helps you sort of create these good habits into your life, and the best way to go about it. And these habits absolutely then lead to hopefully the life that you want to create for yourself. The other book that I wish I'd read when I was 15 is Rich Dad, Poor Dad, and it's Robert Kiyosaki, and the importance of being financially aware and financially conscious. And he talks about passive income, investing, and I read this. It's 2 years ago, and it's been immensely rewarding. It's been the best sort of $7.99 I've ever spent.
Yeah, I read that in my late teens, and you're right. It's a huge impact that book has on you.
Well, I only read it into my late 30s. And I honestly read that book and thought, where have you been? It's been out for like 20 years. I was like, where's this book been? Why didn't I read it before? I wish I'd read it earlier. I really feel I'd be set, and, I'm very comfortable. I'm not complaining, but I'd be really set financially if I'd read this book earlier. And so for young clinicians out there, I think it's important to be financially savvy, plan for the future, invest and save. And that book, Rich Dad, Poor Dad, was instrumental in me changing my financial...
I might have to read it again now. You've inspired me to read it again, I think.
Yeah, it was brilliant. It was brilliant. And so they're two books. But yeah, I'm an absolute junkie for books, and always looking for recommendations. And I follow, sort of podcast wise, I'm a big fan of podcasts. Yours, of course, number one. But then there's a podcast by Tim Ferriss, Srinivas Rao, there's Shane Parrish, Gary Vee. I mean, these guys.
Gary Vee, yeah.
I listen to religiously on a weekly basis.
With so much commuting, you have the luxury of having so many different podcasts and stuff and books you can listen to. That's awesome.
Yeah, and it's had an immense impact on my life. all these podcasts, listening to these individuals and learning from them. And back to a book and the power of a book, it's amazing the value you get from a book that's maybe $10.99, $12.99, or $7.99 in Audible. It's the best.
How much is yours?
Pound for pound. I think it's $13.99 on Amazon.
Man, that's so. If you're a young dentist or any dentist, you should definitely check it out.
Yeah, all the profits go to Dan. Nothing to all that comes away from the $13.99 is the cost of printing the book. The rest all goes to building this dental clinic in Kashmir, hopefully. So
amazing.
Yeah,
I hope you all the best success with that. And guys, if you're listening and you've been inspired by Ferhan's tips and you want to check out the book, I hope you bring it out an audiobook, man. I think you should, because you listen to so much audiobook. You should totally bring it out an audiobook.
Yeah. So that's in process. I will bring it in audio, but it's available.
Amazing.
It's going to be available in Kindle, and then I'll bring out an audiobook where you get to hear my Scottish accent, and I will.
Lovely.
I will read the book out.
Excellent. Well, mate, thanks so much for coming on, and I wish you all the best with that, because it's a great little thing for us, clinicians to have someone to look up to like you to share those similar themes that we might have heard before, but in a way that's so relevant to us. And I like even reading about your background and your ups and downs, medical school, and how you come out the other side, what inspired you, your family and stuff. So again, thanks so much for sending that over, and great for you to share so many gems today on this episode. And I look forward to meeting in real life one day.
Yes, I hope so. I look forward to it. Thank you so much. Thank you for your time. Thank you for having me on.
Thank you so much for listening all the way to the end. Hope you found some value from that. Ferhan, thanks so much, buddy, for coming on. This book, Being Unstoppable, is something you should totally get, because it's just so much for charity. And also, there's a lot of great stuff in here for all clinicians that we can learn from and implement. This episode was just a small flavor of what you can get from this book. Please do share it with a friend if you found it helpful, and I'll catch you in the next episode, same time, same place.